So, hello to everyone, and thank you for being here today. I would like to salute some of the people who are here, very important partners. First of all, Mr. Sam Watts, who is a PDG for La Mission Bon Accueil. Today, we're going to be talking about the resources made available to people from the homeless community. Mr. Watts has a lot of experience in this domain and is a very important partner in this. So thank you so much for being here. Ms. Julie Grenier, who is the Deputy Director at a partnership, the CIUS. And I also want to salute Mr. Serge Darroux, who is our Commissioner in relations with people of the homeless community and who also spends a lot of hours with all members of the City of Montreal finding solutions for those who are the most vulnerable, generally speaking, but particularly in this crisis having to do with COVID-19. So today's meeting, this press conference, is to give you an overview of the measures that have been set up. Since the beginning of the pandemic, really, we've been working very hard with all of our partners, also Public Health, who's not here with us today, but who is a very important partner and who is helping us finding solutions that are both quick and efficient. I would like to remind you that last Friday, we declared the state of health emergency, amongst other reasons, to be able to be more flexible and agile, to find solutions more quickly to this situation experienced by homeless people. And I'm very proud today to be able to tell you that all of this work has paid off. So, to give you an overview of what has been done in the past few weeks, well, we had already announced last week 2 shelters, one at the YMCA downtown, which is destined to women who are homeless, and one at the Complexe Guy Favreau in Ville-Marie, destined to the men. These are really housing shelters. So these are 2 shelters, extra shelters. We also have, as of Friday evening, as soon as we decreed the state of emergency, there was a day center that was open at Square Cabot, which is being operated by Résilience Montréal, an organization. And on the following morning at Place Émilie Germain, we opened another one by the organization called Le Sac à Dos. We also know that the Rural Vic is being transformed to be able to welcome and isolate the homeless community, those people who are either awaiting a diagnosis or who have been declared as being infected. We also have 24 sanitary blocks downtown to be able to support the homeless community. But of course, the needs remain huge. We don't want to leave anybody behind. We've said it many times, and this is what has pushed us to act and go even further. So, what I am announcing to you today. First, as of this afternoon, we are setting up the beds. There's going to be a new shelter for women that will open at the Bon Secours Market. So that's very good news. It will be able to welcome 50 people, a shelter for men. And as of Thursday, another shelter will open at the Jean-Claude Malépard Center, which is in the Center South neighborhood. In total, 60 spots for both men and women. And on top of the isolation unit, of which Ms. Grenier is going to talk to us soon, there will also be a ward that will be open at the Royal Vic that will be able to welcome 100 homeless people amongst the most vulnerable, including the elderly, both men and women. So these beds are being added to the 108 spots for men offered to Complexe Guy Favreau and the 40 for women offered in the YMCA downtown. All these shelters, all the ones that I just named, are being operated by Mission Bon Accueil and other partners that I wish to mention, Mission Old Brewery and La Maison du Père. Thank you to them, to these 2 organizations on which we can always count, who also have a lot of experience in this domain. These new housing sites, this emergency, are going to respond to the needs of the shelters that had to limit the number of beds for the obvious reasons, to avoid spread and respect physical distancing. Now, as we had said last week, when I announced the emergency measures, or the state of emergency rather, we wanted to quickly open 5-day centers outside, the two that I named you, Square Cabot and Émilie Gamelin, and also we're opening 3 more that will be opening today. So I don't know if you realize to what extent in a very short amount of time we are setting up a lot of resources that are absolutely necessary. So the 3 new resources, the day centers, one of these centers will be at Place du Canada, Canada Place, so close to Square Cabot, which will allow to have more room to be able to disperse people and bring different people in different places. So that's very good news. The day center of Canada Place is going to be operated by Mission Old Brewery. Now, at Jeanne Mance Park on the Plateau Mont-Royal, there will also be a day center that will be operated by a regroupment of community organizations. And the 3rd day center will be at the outside of the Francis Bouillon Arena in Mercier-Hochelaga borough, which will be operated by Anonyme. And then for establishments that are outside, because we've received requests for other boroughs, I'm thinking about the northeast or the southwest of the city, there is a project of Meals on Wheels that is starting today in partnership with the YMCA downtown to be able to distribute food to the homeless community. In the hope and the wish to protect not only the homeless community but also the workers who are on the front lines, working incredible amount of hours and are showing incredible devotion, and I wish to salute them all. There is a first delivery of protection material as well as sanitary material that will be distributed to ensure the protection of our workers. And I wish to say that this effort, this material we got thanks to collaborative work between the Health Network and the City of Montreal. Another element that is important, because when we think of all the work that has to be done with the homeless, we often divide it in 3. So the shelters for the nighttime, the day centers, as the name indicates, but also all the clinical aspect of it, of course. And of course, Ms. Grenier is going to be able to talk about it more. But I wish to say that last week, on Sunday, we requisitioned a hotel in the Quartier des Spectacles to welcome people of the homeless community who are awaiting results. We wanted to make sure that these people were isolated for their own good, but also for that of the population in its entirety. The people who will be receiving a positive result will then be sent to the Notre-Dame Hospital. All of that, of course, is in the meantime, because, of course, the Royal Vic is really going to be used as a central place to be able to support the homeless people who are awaiting a diagnosis and for the treatments as well. So as you can see, the City of Montreal is very active. We are working and toiling very hard to help those people that are the most vulnerable. And I've been thanking a lot of people, but I want to thank once again the interveners from the community organizations, the volunteers from the Canadian Red Cross, and all the staff from civil security of the City of Montreal, as well as our partners at different shelters that do incredible work. So as I said Friday, and I wish to reiterate, for us what is important is that this health crisis that we're going through right now cannot become a humanitarian crisis. It cannot become a social crisis. Everyone counts. Everybody must be safe, and everyone must have a shelter. And in a situation such as this one, that is why we're working so hard to find solutions quickly. The situation also evolves very quickly. I wish to mention that we are not in a sprint here. We're rather in a long marathon. Everybody has to work hard at it. And I think that today we are showing to what extent the City of Montreal and all of their partners, we are definitely devoted to leave nobody behind. Thank you.
A few words in English. So I'm here today to talk about the different measures that the City of Montreal, in collaboration with their dear partners, have put in place to support the homeless. Since the beginning of the pandemic, we have been working with our community partners in the field and the healthcare system and public health as well to put in place effective actions to support the most vulnerable people. I want to share some of the things that have been done and also how we're moving forward today, some of the new things we're putting in place. So I've already shared in the past the two new shelters, the downtown YMCA and the Guy Favreau complex. The YMCA is dedicated for women. It's a shelter for women, and the Guy Favreau complex is dedicated for men. There's also two outdoor drop-in centers that open on Friday right after the announcement of the state of emergency. The first one was in Square Cabot, and the other one that is operated, by the organization called Resilience Montreal. And the second one opened on Saturday at Émilie, à la Place Émilie Gamelin, operated by the organization Sac à Dos. The Royal Victoria Hospital is being transformed. It's going to be very important for the entire clinical aspect to support, to have homeless people being tested, waiting for their result. It will be possible for them to be at the Royal Victoria Hospital, and if they need to be treated as well. We have also installed 24 sanitation hubs throughout the city, well, mostly downtown area, to support the homeless population. And though we have been doing a lot, we knew that the needs were even bigger than that. So today, what I'm announcing is all the work that have been put in place, all the discussion, all the hard work of our partners. So tonight there will be new men's shelters that will open right here in downtown, not downtown, the old Montreal, which is the Marché Bon Secours. It will accommodate 50 men's. Thursday, another shelter will open at the Centre Jean-Claude de Malépa, which is in the Centre-Sud area, and it will offer 60 places for both men and women. In addition to the isolation unit, the former Royal Victoria Hospital will also accommodate in the next few days 100 of the most vulnerable homeless people, including older men and women. So all these places are being added to the one that I talked about, the Complexe Guy Favreau and the downtown YMCA. All these shelters are operated by the Welcome All Mission and other partners, including the Old Brewery Mission and the Maison du Père. These new emergency shelter services will help meet the need of facilities that had to limit their numbers of beds in order to respect the social distancing. Now, there's also good news about the outdoor day centers. Like I said earlier, there's two that open, one on Friday and one on Saturday. Our goal was to go up to 5. So there's 3 new ones, one at the Place du Canada in the Ville-Marie borough. That will be operated by the Old Brewery Mission. There's another day center that will open at Parc Jeanne-Mance in the Plateau-Mont-Royal borough, operated by a group of community organizations working together. And there will be also one in the Mercier-Hochelaga Maisonneuve borough at the outside of the Francis Bouillon Arena, and it will be operated by l'Anonyme. Finally, for other boroughs where there's needs, we also decided to, there's a new project starting today, which is a mobile canteen that will, in partnership with the downtown YMCA, that will distribute food to the homeless population that may not be here downtown. So another aspect of what we're announcing is how we are protecting the people that are directly working with the homeless population, that are doing an amazing work, and I want to thank them so much for their hard work, dedication. They're really making a difference, so thank you so much. And so there will be equipment delivered to them. We've started today in terms of personal protective equipment and sanitation equipment as well. Finally, I was about to say Dr. Grenier, but Madame Grenier will share some of the details around the Royal Victoria Hospital because it is an important one. like I said earlier, we will be able to, this is the place where people waiting for results will be able to stay. Though we did requisitioned a hotel in the Quartier Latin on Sunday night because we wanted to make sure that no one would be outside in the street waiting. But of course, the Royal Victoria will be an important part of the clinical path for the homeless population. So my message today is to say that we are working very hard. The City of Montreal is, but in collaboration with all the partners, all the people working really hard to find solutions to help the most vulnerable. And though I did say thank you to a lot of people, I do want to say also thank you to the healthcare system, people that are working there, the Red Cross volunteers as well, the public servants here at the City of Montreal, everybody working really hard. And I've said it when we decided to move forward with the state of emergency, but it is crucial for me and for everybody working here that the health crisis that we are going through cannot become a social crisis. We want to protect the most vulnerable, and this is how we will be doing so, putting our efforts together, working as a team, putting all the energy necessary. And again, thank you for everybody that are doing so on a very daily basis. And for everybody watching me right now, your way to support the most vulnerable is to stay at home and to listen to all the recommendations. This is how we will go through this together. Thank you.
Merci, Madame Plante. Je vais maintenant demander.
Thank you, Ms. Plante. I will now ask Ms. Julie Grenier from the Centre Sud CIUS of Montreal to come and say a few words to you. Good afternoon, everyone. Madam Mayor, hello, and our partners. So I think that this is very good news, as Madam Mayor was saying, that we are together this afternoon to be able to talk about these measures. These measures are, in fact, made possible thanks to the important collaborative work of the city, the health network, as well as our community partners. And we are happy this afternoon to be able to say that there is an offering of service that has been integrated, that has been available in the past few days in health to be able to include all the situation for the people from the homeless community in this particular. So what does that mean, an integrated service? It means that we can orient the symptomatic people to the right places who are either in the public space or who are coming to our resources. Concretely, we just announced the opening of new emergency spots that are being added to the ones that had been previously added, a total of 350 new spots, which will be available to improve and increase the places that are already available in our shelters, places that had to be limited in the past few weeks to respect the public safety standards. And of course, all the new spots that we're opening up right now are done following those very strict guidelines, which are, of course, needful right now. So, moreover, we talked about Bon Secours and Maléport, and we talked about Pavillon M of the Royal Vic Hospital, which will allow us, the mayor was saying, to add an area for people who are older, who are more vulnerable, and to also allow to have a certain grouping of our most vulnerable clients in the context where we really have to be able to work as a network on the entire situation. Of course, the Centre Sud CIUS plays an important coordination role for the logistics of this operation. It does so together with the city, its partners, mainly I would say Old Brewery Mission and Bon Accueil, but there's many of them. And what we are announcing today, as was saying the mayor, today we're opening the treatment unit for the homeless who are tested positive. So the Royal Vic will open its doors today to welcome the people who have tested positive. Right now we have no one to send to that place, but it will be possible as of today. Of course, up until now, the Notre Dame Hospital was also there to be able to be used if the need had been present. I'd like to also go back to the opening last weekend following the requisition of a hotel by the municipal administration, a place of 30 rooms that allows us to welcome people from the homeless community, saying that they did go through a screening test, so while awaiting to get the results. These are measures that allow us to remove a burden to the community network, And that also allows us to not overwhelm the health sector, because we know that right now balance will be very important and will become more and more so. Right now, we also have coordination that is necessary between all those services, so the setup of a phone line that is dedicated to ensure the follow-up of these results for people who perhaps cannot be reached. So with the modality of the hotel also comes the possibility of doing that follow-up for those people who are awaiting their results. Also, there's also accelerated screening that we have set up. That is to say, to make it that the results can come out as quickly as possible to avoid prolonging the stay at the hotel needlessly, knowing that there are a few more difficult parameters to keep people who are, to keep people confined who are normally free. So I think that today we can salute, as the mayor was saying, the results of this collaborative work. It was very important between the Centre-Sud, the city, and the organizations. I personally wish to salute the exemplary work of the community network, despite the fact that it is itself placed in a situation of vulnerability. They are contributing to this collective effort in a really remarkable way. I wish to salute our colleagues from Outbreak, Accueil, and also Maison du Père, the Patricia McKenzie, Bonneau, Duchesneau, and Chez Doris, and all the other ones that have been measured by the city. These people are there despite the fact that they are themselves at the heart of the tempest that we're going through right now. It is also important to mention that other concrete actions that had been set up previously, as an example, last week on Friday, we made a distribution to about 100 organizations, including the shelters and different resources that do street work. So protective material individually, we know that the protective material is at the heart of it all. You heard our Prime Minister talk about it, our Premier, we have to have good use of it, and that is why that was distributed with clear guidelines. And I think that we'll never repeat it enough. It's important. The material, if it's not well used, will not protect anyone. And it is important that the people who are at the front line are able to protect themselves when it is necessary. Of course, on the field, we are still going on with visits by different resources, by the different teams, such as public health and RCUs, in order to accompany as much as possible the setup of distancing measures, as well as the different public health measures that are necessary. English.
Today's announcement is the outcome of a collaboration involving the Centre-Sud, the City of Montreal, and community organization. We'd like to acknowledge the exemplary work of community groups working with us to open these new sites faster by recruiting and training staff despite these groups' own current vulnerable situation. It is important to mention that other concrete action were already taken over the past few weeks to protect the individuals and organizations involved. For example, last Friday, personal protective equipment was distributed to about 100 community groups, such as homeless shelters. Public health also provided instruction on how to use the equipment, as we know this equipment is very precious right now. Regional services and public health jointly visited community organizations to help them implement measures to reduce risk of transmission also. So we are very pleased to keep on the good work together, and we wish everybody that we can fight against this pandemic all together.
Madame Grenier, je vais demander à Monsieur.
Madame Grenier would ask Mr. Marx from Mission Bon Accueil to say a few words.
Merci tout le monde.
So thank you, everyone. Thank you, Madam Mayor. Thank you, Julie. I am perhaps not go through all the details that have been transmitted today, but also maybe just to say, at the beginning of the month of March, we told the CIU Centre-Ville, as well as our partners in the healthcare system, that we would need to do something extraordinary. And I am here today to witness that everybody listened, and that here in Montreal we are starting well with all sorts of measures that are going to respond to the needs. It's a good example of how, when we all come together, the partners, the city, the CIUs, the different community agencies with a certain institutional capacity, we are able to act, we are able to do something that is extraordinary to be able to give services to those Montrealers who have needs. That is something that is so important to me because the people who have vulnerabilities are a special case. And for me, I wish to perhaps talk to my citizens here in Montreal to say, in Montreal, we really want to perhaps see more tolerance for our neighbors, more tolerance for the people whom we see who are in difficult situations. And if you wish to help these people, the easiest way really is to help the organizations that already are there to help those amongst us who are destitute, who are helping those amongst us who are deprived. You know, charity is very often not the best place, so I would invite you to support your community organizations in your community. The other thing that I want to salute, perhaps, and I'm going to try to not become emotional, but the employees. I have the privilege of being the CEO of Mission Bon Accueil, and I know many other CEOs amongst the community network. Our employees were so moved by their reaction right now facing this crisis where the employees are doing such excellent work, and I wish to really mention that and say how much we appreciate it. Madam Mayor, you've said it already, and I'm repeating. And the other thing, I would like to end with perhaps a message of hope, because I am an optimist, and I have a vision. Once the crisis will no longer be here, and I hope that it's soon, you never know, I see a city where each individual can get affordable housing, healthy food, and also to have a community experience. That is the vision that we should all have for our city. You know all how much I love Montreal, and I have the vision that everybody could have something. It's not unrealistic. We could in 2020 and 2021. I think that is something that is not only something we can wish for, but I think it's something that is possible. So thank you very much. Perhaps a few words in English.
Madame la Mairesse laughs at me all the time when I say that. She wonders if I know how to speak English. But I want to say, look, a huge thank you to our community groups that have worked together along with the CIUS Centre-Sud and the La Ville de Montréal. Without this kind of partnership, nothing much happens. We all work in our little silos and nothing really good happens. But at the beginning of the month of March, when we signaled that there might be a problem, and we thought, hey, there's really something extraordinary that we need to do. We need to come together to do something. And I'm happy to stand here today and say that has happened, and it's continuing to happen. We're not out of the woods yet. We're concerned. There are things that are happening in the field. There's a lot of things we don't know. We listen to Monsieur Trudeau and Monsieur Legault every day, and you're hearing different things. So we're still in the middle of this. But we're going to find our way through because we're going to work together. And I want to salute particularly our partners. Already they've been mentioned, the partners that we work with very, very closely. It's very important. Also our employees. I have the privilege of serving as the CEO of Welcome Hall Mission. That's an incredible privilege, but there's many other CEOs and leaders of missions and leaders of organizations in this community, and I know that for us, we hold our employees very close to our hearts, and we have been so impressed by the positive attitude and the way you show up to help out in this crisis that we're all facing. So thank you very much for that. Madame la Mairesse has already mentioned it, so I'm not going to underline it too much more, but I think it's important that we recognize that. I want to appeal to my fellow citizens here in the City of Montreal. If you want to help out a community organization in your neighborhood or in an area. It's something that appeals to you. Don't try to jump in and do things all on your own. That's usually not the best way to help out. The best way is to help people who are already helping those in need. And then finally, end with sort of my vision for how I see the future. This is a time for hope. It's not a time for despair. I typically look out across Montreal and I see a city where everybody has an affordable home, because I think it's possible. I see a city where everybody has enough food to eat, because we've got more than enough food to feed everybody. And I see a city where everybody has the experience of community, because community is what holds us all together. And once we're out of this crisis, this is something that I think is entirely possible. And I think it's a vision that a lot of us share. So thank you very much for listening to me, and thank you very much to all of our partners, and I hope we haven't forgotten anybody. Merci tout le monde.
Merci, Monsieur Watt. En fait, je
Hello. I would perhaps ask all three interveners to go on the scene for the question period. We have a few journalists who are already on the premises, so perhaps go to the microphone.
On peut-être commencer en français. Jeanne, avais-tu une question du devoir?
Oui, Jeanne Corriveau du Devoir. Je me demandais, est-ce qu'on...
I was wondering, do we have any numbers? How many cases of screening tests, positive tests, are there? What we can answer right now is that there's only one person, one homeless person who tested positive, and it is unfortunately the person who died yesterday. It's somebody who was not in shelters. This is a person who was in a unit, in a studio. So it is the only person on the Montreal territory who received a positive result as of now. Dr. Drouin was talking to us about 3 cases on Sunday. Well, there was one case and those that ended up being a false positive and another one that was hospitalized outside of the Montreal region for now. I would like to know, Madame Plante, now 1,991 cases of contamination on the island of Montreal territory. Does that worry you? Well, I would tell you that, well, yes, it worries me. I think that as a Montrealer myself, it is not a number that makes us happy. But am I discouraged or pessimistic? No. No, because the measures that have been set up, the capacity of the network to absorb what is going on, that is what's the most important as well, that we be able to face the situation. So we are following everything very closely. We're working, of course, in very close collaboration with public health. You know, what has to be put forward depending on the results. But let's say that it encourages me even more to double in my efforts to make sure that, Montrealers who are showing a lot of discipline, that they continue following the rules. And I think that it also explains very well why we took the decision to tighten the way that we do things with the police to encourage the minority of people who remain recalcitrant to respect the rules. But might it make you have even more serious consequences? Well, when we're talking about more serious constraint, I see where you're going. Are you thinking, are we going to close down the City of Montreal, close down the bridges? As I was saying Friday, that is not the scenario that we're thinking about in the short term. That said, that decision would be made, and that's important, with public health, the national public health. That is a decision that would be made there, and an orientation that would also be talked about with the health network in the City of Montreal. But as of now, we really want to increase the respect of guidelines by the citizens as well as non-essential businesses, and the police forces are there to help the health network for those who have been diagnosed or who are in the immediate network of people who have the virus, to let them know, to warn them, and to make sure that they are following the rules.
Bonjour, Kathleen Lévesque de la presse. D'abord, Madame Plante, et ensuite j'aurai des questions pour vous, Madame Grenier, si vous permettez. Je reviens sur le...
I'd like to get back to this idea of confinement, of isolation. When we look at the numbers that are, let's be clear, I mean, it's not just significant numbers. We could even say that they're alarming. Well, that is where I can't transform myself in an expert. I am not an expert. And that is where, of course, where Dr. Drouin or Dr. Arruda, they are there to explain to us how and why. I think there are many reasons that were brought forward about the backlog, the number of tests that were done. We're testing a lot in Quebec and in Montreal. There's all those reasons, but of course they are concerning numbers, of course. But shouldn't we, for example, Côte-des-Neiges, that borough, and Notre-Dame-de-Grâce, the city of Côte-Saint-Luc, should we not confine the population in those boroughs, control the movements? These are discussions that we are having constantly with the regional public health as well as the national public health. What Dr. Drouin mentioned previously is that if ever we were to decide to close down Montreal, it wouldn't just be Montreal, because we can see that there are a lot of cases in Laval and Longueuil because, the suburbs communicate directly with the island of Montreal. So it would be a lot more a regional perimeter, I would say, of the greater Montreal agglomeration. As far as particular sectors are concerned, right now, all the energy is being put on creating awareness. There's a lot more police officers in those sectors, and to make sure that the people who, for whatever reason, is it a question of language, for example, we are making sure that the messages and guidelines are being understood. But there is a plan, but it has to be done step by step. And I would like to remind you all, a decision such as this one cannot be taken. I mean, it's not the City of Montreal that would take such a decision alone. It has to be done in close collaboration with the regional and national public health. Should we not also, like what is happening in Europe and Asia, should we not disinfect the streets, the public spaces? Is this something that is being thought about? No, this is not something that is being thought about right now. I think that Dr. Arruda was mentioning that it was not necessary to disinfect park benches, for example, because we don't put our tongue on them in principle. So it also has to be, we have to put our energy where it's most efficient. And from what I understand, the exchanges I've had with public health is that the best way to prevent the spread of the virus right now is to stay at home, to only go out when necessary, go out, have some fresh air, but stay close to your home. You don't go and walk to the other end of the city. You go make essential purchases. You go to the market next door, one person at a time. So you limit the risks of spreading. And from what I hear from public health right now, it is the most efficient way of limiting impacts, the spread of the virus. The masks. Does the City of Montreal and the STM have masks? I would have to check with the STM, but not that I know, because I think that bus drivers are behind or at the front of the bus and people no longer go through the front. And in the metros, the people are in a box, and people are very strongly encouraged to go buy tickets in the automatic distributor. No, but what I meant is, do you have a stock of masks? It's really public health that manages all the material. That is why, I'm not an expert on the management of the material, far from it. All I can tell you is that the material is being distributed. Like today, it's being given to those people who work with the homeless population, because it really is, there's a proximity. So the material is distributed to those people who exert a job for whom there's much more direct contact. Concerning all those huge numbers that we're seeing, 1,991 cases in Montreal as of yesterday, a third of those numbers, of those cases, are not confirmed. Are you able to identify where those people, those Montrealers who are infected, where they live? Listen, we were in an announcement with homelessness, so I'm not going to take the role of Dr. Drouin here today, our public health director. Those are questions that are specific for public health, and I'm not comfortable answering any of those questions. On your territory, then, how many CHSLDs or residences for the elderly, or is there an outbreak of COVID? As I said, that's not really my domain to answer those questions. I'm sorry.
C'est peut-être Madame Grenier. En fait, c'est mon coup de cœur à Radio-Canada. J'aimerais savoir, est-ce que...
I would like to know, all the spots that are being announced today, are they going to equal those who were closed in the course of the past few weeks? Yes, and there's even extra ones, of about an extra 50 spots if we count them between what we had before the crisis and these new spots that are being announced. I also understand that the isolation units at the Royal Vic are going to be opened as of today. Yes, that is for the patients who tested positive. So right now, thank goodness we have no need of it. But it's not an emergency shelter for the vulnerable people. No, that one is not opening today. That of Royal Vic, the M ward, in order to not be confused, should open at the beginning of next week. And these 350 new spots that are being announced, is it going to be as inclusive as it used to be at the Royal Vic? You know, people who were intoxicated, trans people. I think we're in a crisis situation. The idea is to be able to not leave anybody in the street. The Malibal Center, which will open this week, will welcome women, men, couples. So yes, we are making sure that we have very universal welcome. I think that the situation warrants it. English questions?
So to begin, Madame with CBC Montreal, I just have a question for you, Madame Grenier. The question was asked in French, but just to ask again, we were told that Montreal lost about 300 beds for the shelters for public health reasons. With the announcements that have been made today, are we back at where we were before, and is it enough to meet the need that is on the ground right now?
We will be a little bit over from where we started when we closed some beds. As you said, we closed around 300 beds in the last few weeks. And with all the additions that we announced today, we're going to be 350 beds more. So it's 50 beds over for this now on. And we have to think in advance for the evolution of the situation. We're not stopping to work right now. That's the announcement of today. But we still have to work together if the situation evaluates.
Just a follow-up question. There was an incident last week where somebody, from what we're told from homeless shelters, who was tested positive, and police went to a shelter to go to find them, to confine them. And now we're hearing that that situation changed, that maybe it was a false positive, that they went. What can you tell us about this situation and where the breakdown happened in communication?
I could not comment this particular situation, but I think that we're all getting more stressed out, and maybe we all looking forward to see when the situation happens. The happy answer today is that we now have an integrated response to be able to meet all the needs that will overcome in the next few days and few hours.
And a question for the mayor, Madame Plante. We're hearing that we've got a few more beds than what we had originally, but as we know, not all the homeless people in Montreal go to the shelters, and maybe there could be an influx of people who will show up and say, I want to protect myself, I want to be in a closed-off space. Is there a possibility, are there discussions about going even further with either the day centers or beds?
Well, definitely it's something we talk about because it is a possibility, though there might be people that will never want to go in any type of resources, even though it would exist. But it was important for us to stabilize the situation. That's why we called for the state of emergency, to put all the efforts and all the resources together to make sure that we can go back to stabilize, like I said. So yes, there is already conversation with our partners to look at what could it look like in the longer term, because like I said, this is not a sprint, it's more like a marathon. So it will be the case for everybody, including the homeless population.
So there is a possibility of requisitioning spaces like Marché Bon Secours?
Yes, we're looking at all the scenarios for that, depending on how long the crisis will go on.
Thank you.
Question ici de Benoît Chapdelaine de Radio-Canada. Est-ce qu'il faudrait que les refuges demeurent ouverts?
Should the shelters remain open all day to avoid that the homeless go out in the street and possibly contaminate other people? There are certain resources that close down during the day. You know, like Mission Bon Accueil, we close for a few hours to clean the places, the premises, and then we open back up. There are others that remain open during the day. It really depends on each situation, so there are differences amongst those different resources. It also depends on individual preferences because very often some people want to go and walk around. There are other shelters that I know that wish to keep people inside, and it really depends on the situation.
Je continue en français, pardon. Guillaume Pelletier du journal 24 heures, est-ce qu'on sait combien de personnes...
Do we know how many people are awaiting a test and are presently at the Quartier des Spectacles Hotel, and what is the maximum capacity of that hotel? So right now there are 5 people as of this morning who were at the Quartier des Spectacles Hotel, and there are 30 rooms. As we were saying in the previous answers, everything evolves depending on the situation. If it were needed, will the city requisition more hotels for homeless people waiting for a result? Yes.
J'ai la presse canadienne ici. Il semblait y avoir aussi un enjeu.
There seemed to be an issue of workforce in organizations that bring help. How will you find all the resources to welcome those people in the day centers and the shelters?
C'est pas facile.
It's not easy. That's the answer. We need qualified people to come and help the community organizations. I could perhaps, make a call out at the same time. If there are people who are looking at us right now, listening to us, and they are qualified and they really wish to serve, it's a question of being available and serving. We need staff. So we have to reiterate what we said before. Our staff, if I look at the Old Brew Mission staff, Mission Bon Accueil, the 3 that I know the better or the best, these are devoted people, competent people. But at some point we are going to get tired. And it is important. I mean, we've been able to get the people who are necessary for what we developed together with the city, with the CIUS, but we'll see in the upcoming weeks. It depends on a very evolving situation. These new shelters were, of course, necessary before COVID-19. Could some remain open after the crisis? So listen, we have to tell ourselves that we had the overflow unit at the Royal Vic that left, the place for people who will be treated. So that is what made us add the new spots. And what we've announced today is 350 extra spots that will be in function as long as the situation requires it in the context of this crisis. And I think that we'll be able to think evolutively. Mr. Watts often says that we have many solutions also to fight homelessness, but I think that they will at least stay open as long as the situation requires it. What help can you bring to organizations so that people who were once homeless don't end up in the street again due to this? Well, listen, there are different helps available. Since the beginning of the crisis, there are tribunes of consultation, city and health network with the entire community network working around us to be able to capture all those support needs that organizations have. We are working together with that. There are funds by United Way, for example, and we have to keep an eye open for all the new developments that could support them. And we know, and we just mentioned it, that the need for support is also the lack of staff sometimes, or even situations of greater vulnerability of the organization as such. So I think that all needs have to be captured, and I think that there is a network of support that is pretty strong amongst the organization, and we'll continue working together. Also, perhaps mention that the help of the government, the federal government help of $152 million that is going to be given to the different shelters, perhaps it will be able to contribute.
In English, global What provisions are being made for disabled women who are victims of abuse? Being in self-isolation